like every anti-cancer treatment, there are side effects, and these are the side effects associated with a variety of different targeted therapies. The term TKI stands for tyrosine kinase inhibitor. Most of these drugs are oral pills that you take either once or twice a day. And we'll cover some of the side effects in a little bit of detail. So I'd mentioned EGFR earlier. This is an example of a very common side effect that we see in patients who take this drug. They develop rash on their face, and it typically has this appearance. You can also have it on the back, and it has this sort of splotchy red-like appearance. The other thing to watch for when taking these drugs is you can get dryness on the fingertips that can sometimes fissure and crack like this. Another targeted therapy is a drug, or drugs that treat the ALK rearrangement. So ALK is another oncogene driver that we see in lung cancer, and there are 5 different therapies that are available to treat ALK rearranged lung cancers. The side effects are listed here. I will point out a couple of notable ones in these categories. So for crizotinib, the ones that stand out are the vision issues, which can be vaguely described as sort of blurry vision or issues with the peripheral vision. They're not as common, but they definitely affect quality of life. Hepatotoxicity is another way of saying that the liver enzymes, when checked by a doctor, are going up while on drug. That's sometimes a problem and usually requires treatment to be reduced or held. With alectinib and brigatinib, some common side effects that are worth noticing here, there's photosensitivity rash that we see with patients on alectinib. And then with brigatinib, not mentioned here, but there is this very small risk of an increasing shortness of breath and cough that we see when patients first start the drug. And finally, lorlatinib. This is the newest kid on the block. The biggest side effect here is neurotoxicity. And this has been something that has been challenging to manage, but patients will report feelings like they can't think as straight. There's brain fog, that they might have, in the most severe cases, hallucinations. And this, while not common, is a concern enough that it's worth having a conversation with patients about whether this is the right drug or some of these other choices are right for them. So moving on, there's other oncogene drivers we see in lung cancers. BRAF V600E is one of them. And there's a combination of 2 pills that patients can take to treat this type of cancer. This mutation we also see in thyroid cancer. And so it's a very common drug that's used in not only lung, but in thyroid cancers as well. And they can develop a rash like this that's shown here. So rash was the most common side effects that were noted on some of the original trials. Interestingly, these patients are also at higher risk for cutaneous skin cancers, and so they need regular dermatology visits. The pyrexia is another way of saying very high fevers, and these drugs can really cause fevers that can go as high as 104 degrees, and that oftentimes needs dose reductions. Finally, there are drugs that are used to treat MET exon 14 skip mutations. These are rare mutations that we see in lung cancer, but the key side effect that we see with all drugs that block the MET pathway is swelling in the feet and hands that are shown here. And so like any targeted therapy, there are side effects, and these side effects have to be monitored closely by the treating oncologist, and oftentimes the dose of the drug may have to be reduced in order to find the sweet spot of tolerance.